Recognize the gentleman from Pennsylvania, Dr. Joyce, for his 5 minutes of question.
Thank you for yielding, Mr. Chairman. According to CMS data from 2024 on total healthcare expenditures, spending has reached a new high of over $5 trillion. Notably in this report, hospital costs, which now make up for 30% of that $5 trillion, are the steepest rising costs being paid for by the American patient today. There are several forces at work that drive these costs higher. One of the biggest is, as many of you have mentioned, hospital consolidation. In response to the Consolidation in Healthcare Medical Markets, RFI-HHS issued a report concluding that consolidation of healthcare providers has led to higher prices, reduced access, and lower quality of care. Because of the differences in Medicare fee schedules, hospital reimbursements has gone up, while the reimbursement for independent physicians and providers has gone down when adjusting for inflation by 33% since 2001, and patients continue to pay that price again each and every day. When a hospital acquires a physician practice, patients are exposed to higher copays, they're exposed to prices that are increased for the exact same services simply because the ownership and the name on the door has changed. But there are other hidden charges that will occur as well. Mr. Martin, do large hospital systems implement restrictions on their employee physicians and their physicians regarding their referral patterns? Does that affect the bottom line?
Thank you for that question. It is our understanding that, yes, many health systems will impose either direct or indirect requirements on their employed
Do you
physicians.
think that affects the bottom line?
I think it does affect the bottom line.
Dr. DiGiorgio, have you seen instances where this occurs, as well as when a doctor is reprimanded for a referral for an out-of-network referral, and even if it is in the best interest of patient care?
Yeah, I have plenty of colleagues who work for large health systems and have told me that they have faced this where it may be things like losing a parking space or not getting a bonus if they allow what is commonly referred to as leakage outside the system. There's even that term is used for it if physicians in the system let referrals go outside of the healthcare system.
As doctor to doctor, I don't like that term leakage. I think that doctors have a responsibility to provide the best care for their patients. And I think that should be unencumbered by where that patient is referred.
I agree.
Dr. Asis and Mr. Martin, this is a yes or no. Is increasing the Medicare physician fee schedule by tying it to the rate of medical inflation a necessary first step to stop consolidation? Dr. Asis.
Yes.
Mr. Martin.
Yes.
With my remaining time that's left, I'm going to return to you, Dr. DiGiorgio. Beyond an initial down payment for the Medicare physician fee schedule reforms, must we in Congress work to lower costs and increase competition? I have long advocated for the repeal on the ban of physician-owned hospitals. But can you explain how that and other steps are necessary in a minute and a half?
I can give it a shot. So the physician-owned hospitals work because the same physician who sees the patient every day is also the one making operational decisions. So physician-owned hospitals have a tremendous record of providing high-quality care at lower costs than non-physician-owned hospitals. I have a colleague who owns a spine hospital that runs it with about 1/3 of the amount of staff that a similarly sized non-physician-owned hospital runs.
Is the quality of care the same?
No, it's better. And his patients prefer that hospital. They have a net promoter score of 93, where similar sized hospitals have a net promoter score in the mid-teens. So the patients prefer these hospitals. These hospitals provide wonderful care because, again, the physician who sees the patient is the one making the operational decisions. Personally, when I go in the middle of the night to do decompressive craniectomy, 2 a.m., there's no administrator that knows how to do that surgery. There's no administrator that knows what is needed to make that happen efficiently and putting the patient first. Only the physicians have that knowledge. So physician-owned hospitals align the interests and the incentives in the patient's best interest.
Are you aware of where and who owned the first physician-owned hospital in the United States?
I was not expecting to get pimped on that today, so no, I don't.
I wouldn't use that verb. Is anyone aware of that? Dr. Asis, do you know where the first physician-owned hospital was in the United States?
I don't know.
It was owned by Benjamin Rush, a physician who signed the Declaration of Independence. It is owned and was owned by a physician in the city of Philadelphia, Pennsylvania. It is a precedent that should be maintained. With that, Mr. Chairman, I yield the remainder of my time.
Gentlemen,